Experts speak on the efficacy of traditional therapy versus alternative therapies for PTSD of active duty military and veterans returning from war. Every day in the United States, 22 veterans commit suicide. The capacity of the mental health system to treat and care for soldiers returning with PTSD is failing. The VA does not have adequate resources for soldiers and veterans, forcing them to seek alternative therapies. The increase in military members returning from war with PTSD has increased dramatically in the past decade. Which therapies treat PTSD most effectively? Introducing our experts. Our first expert lives in Bethesda, Maryland. His name is Rick Yunt, and he is a licensed social worker. He is also the creator of Warrior Canine Connection. Our second expert is Matthew Young, PhD. He has a PhD in neuroscience and has researched extensively focusing on neuropharmacology and neurobiology of anxiety and fear, in particular with regard to PTSD. Rick Yunt advocates for alternative therapies for veterans, particularly service dogs. He notes that PTSD is typically caused by humans and human situations, therefore they may be a trigger for PTSD. However, dogs are perceived as trustworthy and give the veteran a sense of security. Studies have shown that with service dogs, there is an increase in patience and impulse control, emotional regulation, improved ability to display affect, decrease in emotional numbness, improved sleep, decreased depression, startle response, and pain medication, increase in sense of belonging and assertiveness skills, improved parenting skills, and family dynamics. They also become less reliant on powerful pain and antipsychotic medications. Matthew Young advocates for different types of pharmacology rather than antipsychotics. He supports a new therapy that has been tested only in animals at this point, but it's the injection of MDMA, which is another name for ecstasy. When mice were treated with ecstasy and then exposed to stressful or anxious types of therapy, after they were injected with the MDMA, they reacted differently. So they retrained their brain to have different responses to fear and anxiety. He also notes that veterans who do engage in pharmacotherapy and psychotherapy have better outcomes than those who engage in pharmacotherapy alone. Rick Yunt has powerful points. His points are that psychopharmacology are ineffective, there's lack of support for veterans, and the medications are dangerous. Matthew Young supports drug therapy, particularly new ones. He also researches relearned responses based on the use of the medications, and that the MDMA changes our thought process at the molecular level. What the two do have in common is that psychotherapy and pharmacotherapy, when combined, are the most effective treatment rather than pharmacotherapy alone.